Hello class, my name is Rick Renaud. I'm a BSN student at Polk State College, and this is my professional portfolio. This first section is my resume. It goes back 2010 was began my first career as an electrician. I worked for a company as a lead electrician for a residential and commercial electrical contractor. There I gained a lot of experience in reading blueprints and organizing installations of jobs to the builders and homeowners specifications. I developed good customer service and listening skills with homeowners there. I also led a crew of up to 3 guys and managed the daily workload by assigning tasks and following up on them. This helped me to learn team building skills. Next was my career as an RN. Started about 4 years ago, where I became a nurse tech at the hospital. I was in nursing school then and gained hands-on experience with doing the ADLs, monitoring eyes and nose, and vital signs of patients. From there, I moved on and began my first days as an RN in January of 2017 on the neuro floor as a staff nurse. I have gained experience managing patient care of up to 6 patients there and have subsequently precepted several new RNs, as well as started charge nurse duties there. I continue to work on the same unit that I originally began on to this day. My PDSA project was centered around making patient transfers from the unit to the floor. Goal was to help kind of reduce the anxiety of new patients transfers by having a handoff checklist to quickly review when the patient was transferred. The reason is sometimes when getting a new patient, especially if it was a new patient like from open heart, there's a lot to keep up with as far as drains, tubes, and lines go. This tool would encourage a short review as the patient arrived. The unit RN currently gives a report over the phone and then transfers the patient down there. This form that would be handed off during that process would encourage a quick bedside assessment of at least the tubes and drains. It started off during a morning huddle. The project was brought up and explained to the staff on the unit, and the form was explained to them. Initially, 3 nurses were surveyed on the satisfaction with the report, and scores showed an average of about 3 to 6 out of 5. The initial cycle showed an increase in satisfaction of about 10% using the form. After reviewing the forms, one issue was one of the forms was only partially filled out, and this was addressed with the second cycle. When the second cycle was ran, it was on a much larger group. The satisfaction increase was only about 7%, though it did still yield positive results. You can see here just a chart that showed the initial cycle with an increase, and the second cycle showed an increase also. Overall, the PDSA results were positive, even though there was resistance along the way by some of the seasoned nurses. It was explained to them that it was to help, especially with the newer nurses, to make patient transfers easier and better for them. The average scores were increase of 10% on the first and 7 on the second with more patients. And overall, the tool did encourage a little bit more of a bedside report, though the majority of the report was over the phone. The implementation phase consisted of just making the resource available to the future and patient transfers. They were copies of the form were placed in the area where the standard report sheets were to make them available for future transfers. My BSN journey has been a long one. The perception has changed over time, of course. Initially, when I first started, I saw it as mandatory education that we had to do. And initially getting into it, I thought that a lot of the information was didn't have anything to do with my job, so I couldn't really appreciate it. I thought it was more like busy work. As I moved through the program, there were courses that I took that kind of opened my eyes to different aspects of the profession and kind of increased my knowledge base as far as the role of the registered nurse. It let me see different areas where nurses can work and the different aspects that they can contribute to the organizations. It has also, gave me experience in, evidence-based practice, looking things up and trying to always look for improvement as far as providing care and caring for our patients. After getting the foundation of the BSN program, the tentative 5-year plan is to just continue to take on the charge nurse role more frequently. I still like to be on the floor, but it's a different kind of workflow being a charge. I would also like to obtain my certified med-surg certification by 2020 and my stroke certification by then. Ultimately, I will probably be going back to school for a master's or an NP program, but at this time, I'm just concentrating on the short-term goals. Either way, I'll be further in my career as a registered nurse.